Adolf Gundersen was skilled, industrious, and scholarly. In Norway, it was difficult for young physicians to build a career. Newly graduated, Dr. Gundersen took the risk to come to America in 1891 seeking opportunity. He joined a fellow Norwegian's practice in La Crosse, which was then a gateway to the West. The frontier ethic was alive and well. Medicine was equally untamed. Anyone could claim to be a doctor. Gundersen competed with untrained doctors, natural healers, and promoters more focused on marketing than medicine. His partner excelled at diagnosis. Gundersen brought the business and surgical skills that made their practice the most renowned in town. It was said that the life cycle in La Crosse consisted of birth, baptism, an operation by Gundersen, and hopefully much later, death. He brought his new wife Helga to La Crosse in 1893, and their success compelled them to stay. They would go on to have 8 children, with 6 becoming doctors. This medical tradition is alive and well. Today, a 4th consecutive generation of Gundersens practice medicine. Gundersen served as the first medical director of La Crosse Lutheran Hospital in 1902, while continuing to run his clinic. In an era when the cause of infection was disputed, he championed surgery that minimized incisions and reduced infection. He was decades ahead of his peers nationally on internal and ambulatory surgery. Frustrated with the outcomes from other doctors, he pushed the hospital board to standardize who could practice medicine at the hospital in 1917, and Gundersen's firm was put in charge of this. Colleagues were dismissed and then filed suit, but the Wisconsin Supreme Court vindicated Gundersen's approach. For the first time in Wisconsin, hospitals had the right to regulate who could practice medicine in their building. Gundersen initiated a requirement to exclusively use typewritten medical notes in the 1920s, decades ahead of other medical leaders. This greater legibility reduced medical errors, built an extensive patient history fueling future research, and minimalized hospital liability. By 1927, 3 sons practiced medicine with Gundersen, comprising half of the doctor's staff. Gundersen valued education and traveled to Europe early in his career to learn from the finest surgeons in the world. He annually sponsored 1 Norwegian medical student to study in America. He was also the first to establish a medical internship program for students in Wisconsin and would go on to serve as a regent for UW-Madison. Gundersen led the hospital through growth, expansions, and the Great Depression before passing away in 1938. Once a small clinic, now the Gundersen Health System has 3 hospitals, more than 50 clinics, and robust programs in medical education, nursing education, and research. This year, more than 500 doctors, medical residents, and fellows, and nearly 300 associate staff in 3 states will oversee the treatment of more than 1.2 million patients. It's been more than 120 years since Gundersen came to America. Today, residents of La Crosse, as well as many other towns, can still claim that the life cycle consists of birth, childhood, an operation by Gundersen, and much later, death. Transforming a clinic's operations, overseeing a new hospital, enhancing operational and hiring procedures. It was Gundersen's business prowess that built the foundation for the Gundersen Health System of today. In recognition of this pioneer businessman and physician who maintained the highest standards of quality and was dedicated to enhancing his craft, we honor Dr. Adolf Gundersen and posthumously induct him into the Wisconsin Business Hall of Fame.